Welcome to HIMSTalk.ph, the official talk show of HIMAP, the Healthcare Information Management Association of the Philippines. HIMAP is an industry association comprising of companies offering healthcare information management services to the global market. I am your host, Vincent Remo, and I am joined by my co-host, JL Botor.
Thank you, Vince. HIMS is short for Healthcare Information Management Services, and in this show, we will be featuring companies who have become part of this growing industry in the Philippines, providing accurate and reliable HIMS services to global companies.
We will introduce case studies, meaning actual experiences of companies based in the Philippines, focusing on how their solutions and services have helped the global healthcare ecosystem by simply serving the needs of their clients. This is HIMSTalk.ph. This talk is all about HIMS.
We've got an exciting show for you today. Our topic is Chronic Care Management for American Patients, delivered from Makati, Philippines, the Visaya KPO Story. Allow me to introduce our speaker. Our speaker for today co-founded Visaya Knowledge Process Outsourcing Corporation, or simply known as Visaya KPO, in 2007 with his son. Since then, they have grown the company to more than 700 FTEs serving four verticals. Number one, contact center service delivery. Number two, healthcare information management. Number three, finance and accounting outsourcing. And number four, IT consulting. In 2011, Butch was elected to the board of directors of the Contact Center Association of the Philippines, the official organization of contact center companies with more than 90 member organizations. Butch is a graduate of the University of the Philippines with a Bachelor of Arts in Economics and Political Science, and he has a Master's in Business Administration from the Grasadio School of Business and Management, Pepperdine University in Malibu, California. He has held positions with Fortune 200 companies as Director of Management Information Systems for FMC Corporation's Agricultural Chemicals Group, Asian Regional Office in Manila, and as a Director of Strategic Planning and E-Business for ITT Industries in Foothill Ranch, California. He was also a Director of Information Systems and Financial Controller of Flowjet Corporation in Irvine, California, and a management consultant for Providence Enterprises Limited, a contract manufacturer in Shenzhen, China. Ladies and gentlemen, to talk about his first-hand experience on how their company started and grew their remote chronic care management service from Makati, Philippines, please welcome the founder, president, and CEO of Visaya KPO, Mr. Butch Valenzuela.
Thank you very much, JL and Vince. Hello, everyone. My name is Butch Valenzuela. I am the president and CEO of Visaya Knowledge Process Outsourcing Corporation. We were established in 2007. My son and I actually started the company. We started out as a call center, but today Visaya has grown to about 800 FTEs with four lines of businesses: the contact center service delivery, healthcare information management, finance and accounting outsourcing, and IT management services. We service our clients from two facilities that are geographically separated for redundancy and business continuity. We are looking to open our third site in the city of Bacolod, which is down south from the Metro Manila area, to cater to our expansion with healthcare clients. In our healthcare vertical, we service a good majority of the revenue cycle throughout the revenue cycle, spanning medical coding, billing, collections, denied claims management, charge entry, and many other processes. Today, however, we will be talking about chronic care management. I would like to highlight how nurses here in the Philippines are able to help patients with chronic diseases in the United States with their care. Let me give you a case of one of our clients. They are an ACO in the East Coast that cater to about 160 oncologists. Their patients are mostly elderly with cancer. They have signed up for Medicare's oncology care model. As the healthcare industry in the United States transition from a fee for service to a value-based care model, the goal is to provide better patient care while lowering the cost of care to get better patient outcomes. Our client has relied on Visaya to be able to provide that patient care utilizing portions of the 13-point care model of the Institute of Medicine Care Management Plan. Upon discharge from the hospital for either chemotherapy, radiation treatment, or surgery, Medicare pays a doctor a fee to ensure that their patients are taking their meds, visit their physicians to prevent unnecessary readmissions or emergency visits. Our nurses are trained to provide the utmost quality of care of the patient in their interactions. Any of the non-emergency type visits or questions would be directed to the ACO's physicians that are open 24/7. The service that we provide is able to lower the cost of healthcare while allowing access to 24/7 care, thus improving the quality of care of the patient. At the same time, there is a point of emphasis to maintain the quality of care that is available to each person who requires assistance. By outsourcing the call interactions, both outbound and inbound, patients are able to have access to a nurse that would be able to provide emotional assurances to the patient that they can call at any time and someone would be there to cater to their needs. Our nurses are able to provide outreach to the patients to check on their well-being. As long as our nurses do not provide any type of diagnosis or treatment to the patient and only strictly provide care interactions, augmenting the post discharge care that the ACO provides to their patients, our client has been able to lower their costs, have been able to provide better quality care to their patients, and hence achieving better patient outcomes. As the population of the baby boomers in the US reaches the age of 65, the demand for taking care of the elderly will grow. Today, there are about 76 million baby boomers. Medicare has to be prepared to cater to this growing population. As the cost of healthcare grows, the ability to outsource work to nurses here in the Philippines becomes a great help to healthcare companies in the US. Besides, do you know of any hospital today in the US that do not have a Filipino nurse in their staff, right? Filipino nurses have been frontliners in patient care in the US for a very long time. Thank you very much.
Thank you, Butch, for sharing that story of yours and Visaya KPO. It's quite an amazing story. I'm sure the viewers are wondering how you came across your first deal, how you came across your first client, and how you were able to set up these operations in the Philippines. Can you share with us that story as well?
It was very interesting because our client, basically the CEO of the ACO, was looking to actually see if they could find an outsourcer to be able to handle the chronic care management process. And he came along, on our website, basically decided to actually contact us through our website. And I visited them in New York at that time. And we basically became, he was comfortable with what we can do. And that's how we all started. Started small, and then it actually grew to about 120 nurses in our staff.
Butch, I'm interested about the statement that you just said that you started small. When you mentioned that you started small, what basically are the pain points that you encountered during that time until such time that you are comfortable of basically growing that service?
Well, I guess when it comes to chronic care management, you can imagine that basically these patients, upon discharge, right, and you're trying to call them, um, unless the doctor actually provides information to the patient that our nurses will be calling you to provide you with your daily care. Um, people don't normally pick up their phones, right? There is the people today, when people call them and they don't know who that number is, the instance, in that instance they'd probably think that it was a telemarketer that they would be calling. So we had to overcome that. We had to actually talk with the doctors in order for them to be able to inform their patients, provide a leaflet or an information packet to their patients, to so that their patients actually know that this is the doctor's office that will be calling them. And that was something that was quite challenging in the beginning. But as we figured out how things actually worked, and in working with the client, we were able to overcome that over a period of time.
Which, just to put things into perspective, I'd like to identify the key players in this service, as well as how this process is delivered to the patient. So you have the patient, then you have the nurses here in the Philippines, and you have the doctor or the doctor's office in the United States. So how do these players interact, and what is the process behind all of this? Can you walk us through that process?
Sure. Typically, and as I said earlier, it is very important that the patient knows that somebody from the doctor's office will be calling them, right? So, from a patient perspective, they don't really necessarily know that this service is an outsourced service. Um, as long as the doctor is able to provide their patient upon discharge a packet that says we will be calling you. So it's also an education, basically, educating the patient as to what will happen. I think is very key to this process, because otherwise it will not be successful unless the patient actually understands that there will be a nurse that will be calling them. Now, once you've overcome that, it's also very important for the patient to have great rapport with the nurses. So typically we would give them an extension number of the nurse that has handled them from their very beginning, and they when they call in, they could actually call into that extension and they'd get the same nurse, unless that nurse is busy, and then it goes to voicemail for that particular nurse. Um, but it's really driving that rapport between the patient and the nurse, right? And because basically the nurse will be, taking care of that patient over the next 6 months.
Well, thank you, Butch, for describing to us what's happening from the US side. Now, I'm interested to know about the service you are providing from the Philippine side. What is the typical day in your office for this type of service? Can you walk us through the process?
Sure. Basically, our office is a 24-hour service. So we have nurses deployed, on a 24-hour basis, and 24/7. Basically we pretty much work around the clock. Um, Having to figure out the type of nurse that would be able to do this is also another process that we started to learn over time. Um, there are people that could really talk over the phone or talk on the phone, um, and there are people that can't, right? So it's really understanding the role that the nurses would play in this process. It's also having to understand the type of um, resource that we would be hiring for this process, and also really understanding, you know, I mean, in the Philippines, we have nurses that are both just Philippine nurses as well as, um, you know, US RNs. In other words, they've already passed the NCLEX boards. And we also had a couple of, we had one oncologist on staff, as well as another MD, to really be the operations head for this process. So really, we had, um, over time, really learned how this process really needs to, flow properly, so that it becomes effective. Bottom line is, this is about a patient and a nurse interacting, right? And that interaction is really important to make sure that the patient is comfortable, and be able to count on the nurse whenever there is a need, on the patient side. The other challenge that we've had is, some, because we're dealing with the elderly, and it's, they could either be in conservatorship, or it would be a relative that would be taking care of them, or they're in a house, in a nursing home, for example. So it's having to really be able to talk to a that relative, for example, and be able to convey, and find out exactly how the patient is doing at that time, right? The whole goal here, this is all about value-based care. It is about the oncology care model of Medicare. And, um, you know, Medicare's goal is to be able to lower the cost, improve the quality of care to get better patient outcomes. And if you're able to achieve that, then the doctors actually also get, um, a bonus, if you may, for that quality of care that they provided with, the lower cost. And that's where Medicare measures, the doctor from that, based on those two criteria.
I hope you don't mind sharing with us, Butch. What could be your secret sauce? I mean, the secret sauce that you have added to this service to make this typical BPO service what it is today, to make it something unique, a unique selling proposition perhaps to your clients.
Well, I guess, as far as, there is the business aspect of it, but the bottom line is, I think it's also making sure that our nurses are able to provide the proper care, and, be able to provide, um, that rapport, be able to provide the good, relationship. It's all about relationships, right, with the patient. And if you're able to do that, then the patient becomes comfortable, to be able to speak, and be able to tell the nurse exactly, um, you know where they are at, post discharge.
Which, going back into the nurses and your case managers, are these people engaged the whole time? And who manages them while they are providing the service?
Well, as I actually said, we do have an oncologist on staff to really also. I guess there are different components to this. Obviously there is the medical chart, that we are able to look at. understand, the condition of the patient. So we could actually, from that medical chart, also on the notes, be able to record, whatever interaction. So the there is the medical, the EMR that we work with, but there's also a CRM that we work with. And from a management perspective, we had a doctor that basically is the operations manager for this particular account. And, we also had a subject matter expert, which was an oncologist, to be able to read the chart if there was any issues that the nurse would not be able to handle. Um, and basically, the combination of all of these, it almost, especially now with COVID, it becomes, uh, more important to, you know, be able to handle it on a work from home perspective. Um, and most patients don't necessarily want to go to a hospital to receive that care. And basically that is really the whole goal. The whole goal is to prevent readmissions, as well as prevent unnecessary, um, you know, emergency room visits or urgent care visits, right? Which becomes very expensive.
So this service, is it unique to the US market, or is this something you can also offer to other countries? Is it dependent on the healthcare system? What can you say about that?
You could theoretically offer it to, other countries. I guess this in particular is a Medicare program, part of the oncology care model. And Medicare has different chronic care management um, models that are, available. I mean, when you talk about chronic care, it's all about, chronic diseases like the heart, um, or diabetes, or even drugs, or when it comes to mental health, that could also be a chronic disease. So there are many chronic diseases out there, but Medicare has certain programs for certain chronic diseases that, you know, um, wherein their whole goal is to really lower the cost of care, the cost of healthcare.
Looking at what you have been doing for the past period, what can you say is the overall impact of Visaya KPO's chronic care management service, especially to the patients, to the insured companies, and generally to the whole US healthcare industry?
I guess there are two ways to really answer that. There's a business aspect to it, which from an ACO perspective, if they're able to achieve, um, the bonuses that Medicare would give, that's really where, and I call it bonuses. There's another term for it, right? But that's really where they're able to make the money from that perspective. Um, so from an ACO perspective or from a business perspective, it's really having to provide the proper rigor in order to provide the proper care, to where, from a, in call center lingo, it's called a CSAT, wherein you have, you know, good, I guess, feedback from the patient. Then you're able to really, see the value of it, and doctors are able to see the value of it. So that's one side. There's the business side, wherein, the ACO are able to um, derive more revenue from it. There's also the patient side, which is really, from a patient perspective, if you're able to be successful in it, and your nurses are able to really um, provide that quality of care to the patient. And when I say quality of care, that you know the patient actually is able to be comfortable, and if there's a need that they can call, if they also understand that there will be somebody that will be calling them to monitor whether they've taken their meds, gone through their doctor's visits, so on and so forth. These are preventive measures that you put in place so that patients don't go through readmissions. Then you know then it becomes a very successful program.
What do you think would be the impact of technology or disruptive technologies to the service that you are offering? Like, for example, AI, automation. Is this something that's a threat to your business, to your service, or is it something that you could leverage to further improve your business operations?
In today's world, there is what you call RPAs, which is remote patient or RPMs, remote patient monitoring, wherein you use technology to monitor remotely blood pressure, whatever statistics there are, and basically be able to also talk to the patient through the device if there is a need to talk to that patient, or even just having nurses monitor the vitals of that patient through that device. Um, you know that type of technology, and we do have RPA clients. um, we have a couple of RPA clients or RPM clients that we have actually engaged and be able to work with them, and hopefully there will be growth in it in the future. But I'm really excited basically to be able to do that, and be able to gain more traction with RPM technology.
I hope we still have more time, but I guess that's all we have for today. Once again, we would like to thank our guest, Mr. Butch Valenzuela, CEO and President of Visaya KPO.
Thank you,
Thank you very
Butch.
much, gentlemen.
Thank you.
In this episode, we got a glimpse of another unique type of service offered by a company operating in the Philippines. It is worth noting that this service requires knowledge of the US healthcare system, combined with the skills needed to analyze situations and respond accordingly. What Butch shared today is a testimony to the quality of work Filipinos can do, and combined with the right level of management capability, this service has been recognized by the client as part of their best practices.
Join us again next time for another featured case study. We are your hosts. I am Vincent Ramo.
And I am JL Butor.
Thank you for joining us, and we hope you'll join us again in future episodes of HIMSTalk.ph. This talk is all about HIMS.
Keep safe, everyone.
Bye.